Donald Trump continuing to fill out his picks for the top health spots in his second term. On Friday, naming Fox News contributor Dr. Janette Nesheiwat as his choice for Surgeon General, and Dr. Marty Makary, another Fox talking head who's opposed COVID vaccine mandates, to lead the FDA, and Dr. Dave Weldon, a former congressman who, while in office, promoted the debunked link between vaccines and autism to run CDC. Trump has already announced Dr. Mehmet Oz, who has a long record of shilling unverified cures and supplements, as well as financial ties to pharmaceutical companies to run Medicare and Medicaid. Robert F. Kennedy Jr., a lawyer with a long history of promoting conspiracy theories, to oversee all of these agencies, reportedly already staffing his quote-unquote Make America Healthy Again team with anti-vaccine advocates. Joining us now, internal medicine physician Dr. Lipi Roy, David and Molly are here as well. All right, hi. Good to see you.
Great to see you.
What do you think of these choices?
So let's start with CMS. This is typically an agency that's led by people with significant experience in health insurance and health policy. Dr. Oz, a cardiothoracic surgeon, television doctor, in and of itself not a bad thing, but he's kind of gone back and forth in terms of where he stands with several issues. So back in 2010, he actually urged Californians to sign up for the Affordable Care Act. And by the way, in full disclosure, I appeared on his show, the Dr. Oz Show, years ago to talk about fentanyl. And in his defense and his team, they allowed me to provide evidence-based information. But we also know that the BMJ, I mean, I'll say he's a nice person, a very smart guy, but my personal opinion should not matter. The BMJ, the British Medical Journal, published an article in 2014 looking at randomly 40 of his episodes and showing that almost half of his health claims were not rooted or based on medical data or scientific literature. So as a physician, that's what really matters to me. These doctors that are being selected, as long as they're creating health policies that are rooted in data, in medical, the best available scientific data, that's what's going to really matter to me.
What do you think this means, like, for most Americans? Most Americans, you're throwing around sort of some of the acronyms that we use to discuss these agencies, and it's critically important. And yet, I think people wonder, like, okay, like when I send my kids to school, when I go to the doctor, what are the implications for me?
Yeah. So, other implications that really matter to me and other fellow medical professionals. So. Say, like Dr. Marty Makary, right, for the FDA chief. He's somebody who, again, a surgical oncologist by training at Hopkins, but he's also aligned himself with a lot of, say, RFK's policies, especially during COVID, which were not, he was against vaccine mandates, he questioned masks, he promoted herd immunity. And again, these are not really policies that, policies that were rooted in science or data. So let's use this vaccines as an example, right? We want to make sure we have people that are in these leadership positions that are promoting policies or making decisions that will keep children and elderly family members, like in my own family, safe and healthy. We know that vaccines, as one example, is something that it's probably the most effective health intervention, public health intervention to keep people safe. And unfortunately, several of the picks so far have not really they've promoted vaccine skepticism. So those are the things that are really concerning for people like me.
So let's say they just all get confirmed. They're all in there. They're making policy and decision. What is the hardest thing then to undo?
Anything right now.
Because they try to remind us, right, that there's the reality of what we live with for the first few months, and then there are the realities that once you begin dismantling certain policies or putting certain policies in place, it then can very often take months, years to undo those changes.
I'll tell you one thing. What me and several of my colleagues, we were just discussing this. One thing that actually looks like a positive thread seems like their policy on food, right? So they're saying that they want to really go after chronic diseases, which is great for a former primary care doctor like me, right? So the leading causes of death are chronic illnesses that are preventable, really, mostly by food. So are they going to make policies that will really keep people safe? Are they going to go after food industry, processed foods, many chemicals, which which are addictive, and I'm an addiction medicine doctor, so that really matters. But they got to do it the right way. They got to make sure that they're going to make sure that they address food deserts. They're going to get, fruits and vegetables accessible to school children. I mean, those are the things. But to Alicia, to your question about what's going to be hard to undo, should they make poor decisions that are truly harmful, really the ones that we've already seen happening in several states all over regarding women's health. That's going to be really, really hard. And I'm already seeing this in patients, female patients who receive contraception, who've been traumatized, who've been assaulted. We're already seeing these ramifications. Look at what happened to Amber Thurman. We're going to see far more of these cases if that really expands and rolls out. Again, abortion care is health care. It should not be politicized.
Abortion care is health care. It also became an economic message during this campaign. And I think if the pandemic taught us anything, it was that there is a direct interplay between healthcare in this country and the economy in this country.
Absolutely. I hear you talking about this, and a lot of my work is focused on the Treasury Department or the Federal Reserve, and to a T, every time I talk to somebody who's run one of those agencies, those departments, they're so deferential to the work of the staff at those institutions, and I think that that's something that might rightfully worry a lot of people who watch all of this unfolding. If you look at the sort of healthcare system in our country, if RFK is spearheading this, one would hope that somebody in his position would be listening to kind of the font of research and data-driven work that people in that department have been doing. And I think that there is a reasonable fear that if somebody comes into that job lacking the requisite managerial experience, lacking more than just kind of interest in pursuing agendas that he cares passionately about, that could be really deleterious. And you talk about sort of like the long-term effects of all of this. And this is, of course, being engineered by this transition team and this incoming administration to sort of root out people who might object to what those policies from the top are going to be. So I think that's something that just probably would incite a lot of fear. You hear RFK talk a lot about data and vaccines. I remember covering the business of firearms, the business of guns, and there has been this cry for so long that public health experts aren't allowed to collect and analyze data on gun violence in this country because of restrictions that are put in place in these agencies. I think that proliferation is something that would give a lot of people pause if they knew that was happening from the top down.
David Groh, what a treat to see.
Good to see you as well.
Thank you so much for being here. Molly, thank you. Dr. Lipi, we're coming straight from clinic. Thank you so much. A very quick break for us. We'll be right back.